My name is Eric Cornave. I am your host for today for this live info session hosted by the International Hospital Federation to kind of talk about the rules and regulations in healthcare. And I'm joined today by three experts. So as I said, my name is Eric Cornave. I'm the course director for this course. We will give you some more information about this later on at the end of this seminar. So the objective of this session is to explore the good, the bad, and the ugly, or the good, the bad, and the complicated of regulation in health and social care from the perspective of healthcare operators. And I'm glad to be joined today by three global experts who've joined this call, and I'll introduce them later on. They will each talk about how organizations can improve performance through regulatory compliance. We have some questions and answers that you can post. You can post your questions, and don't feel free to post any question if you have them throughout the whole session. So regulation can be broadly defined as control exercised by a public agency through directives, monitoring, and enforcement efforts over activities which are valued by the community. Now, every country is doing this differently, and regulation is all around us. And it's important to understand what's designed to do, what different types of regulations there is, and most important, how regulatory efforts can have a bigger impact, especially on the safety of our patients, and the quality of our care, and the impact it has. So last year, the International Hospital Federation, we launched a fully online self-paced course on regulatory excellence in health and social care to support learners gain better understanding of regulatory excellence. A lot of people have already joined and successfully completed the course. It takes around 4 to 6 hours to complete, and you can do this in your own time. And at the end, you need to do a short exam at the end of each of the 6 modules. And if you pass them all, you get a nice certificate from the IHF. So we have a short poll, or 2 polls to be precise, just to kind of get you into the mood of regulation and to kind of see what your thoughts are about this topic. And you can post your answers now. There's no right or wrong answers. We have 2 questions. The first one is what is the best way to improve healthcare quality and performance? Pick your answer. You can only pick one. So is it to introduce new standards and guidelines? Is that the best way to improve healthcare quality and performance? Is it to reward and recognize good practices? Is it to audit more stringently? Or can it be best done by establishing heavy fines and penalties for non-compliance? So I see some of these answers are more supported by people. We have a lot of people saying that we should reward and recognize good practice. That's always good. Introducing new standards is a good thing. Audit more stringently is also an option. Nobody's going for the heavy fines and penalties for non-compliance. I wonder why. Maybe the panel members can speak about it as well and tell us how many fines they've accumulated and penalties for non-compliance. I'm only kidding, but I think the overwhelming majority is voting for rewarding and recognizing good practice. So I think I would agree. We will cover some of that in today's session, I'm sure. Even more people are voting for that. So rewarding and recognizing good practice is probably one of the best ways to improve health quality and performance. I would agree. I think the other 2 out of the 3 are probably also very, very good. And I'm glad we see the whole spectrum. Nobody seems to like heavy fines, and I would agree. So the second question is more to your situation, and we'll hear from 3 speakers today who will highlight some of their experiences in their setting. So in my country, so wherever you are, or people have already filled this in, most regulatory systems measure activity better than they measure impact. Okay, that's I'm glad to see a few people who fully disagree with that. So they're in a country where the regulatory system measures impact rather than systems or the other activity. Again, a little bit of mixed bag there. You mostly agree that your regulatory system measures activity better than they measure impact. I think we'll hear some more for today from the speakers who are on this call. from Marco, Tiffany, and Cobus about this. But it's interesting to see that most of you agree that regulatory system measures activity or processes better than measure impact. I think that's kind of a view of most people around the globe. And if we can take this poll as another another more evidence of that. So yeah, so today, as I mentioned, we will hear from the three experts who will share their experiences of being regulated in different parts of the world. All of the experts today have been recognized as young executive leaders by the IHF, by the International Hospital Federation. And we just briefly introduce themselves, and then we can go on to their feedback. So first of all, we have Cobus Joosten. Cobus is a distinguished healthcare operator and a leader over 10 years experience across different settings and mainly around clinical management, strategic healthcare delivery. He's currently working in the Middle East with a large healthcare network called Mediclinic, where he focuses on operational excellence, performance improvement, and building high-performing, patient-centered healthcare environments. And throughout his career, Cobus has led complex operational portfolios across diverse healthcare settings, driving improvement in efficiency, financial performance, and patient outcomes. So welcome, Cobus. And I know you have a hard stop, and we're glad to have you here, but you have a hard stop, so you go first. But let me introduce the other two before I hand the mic over to you. So I think the next person up will be Marco. Marco Saavedro Bravo is from Brazil, and he's the founder of a healthcare company, ILES or ILES. I'm not sure how you pronounce it, but ILES is good. Okay. Thank you, Marco, for being on the call. It's a consulting company, and he's also an associate professor of healthcare business management and is a certified facilitator at the Geneva Sustainability Center. Previously, Marco was quality improvement manager in a large hospital in Brazil, and he will tell us a little bit about his experiences there. He holds a degree in industrial engineering, postgraduate in operations management, black belt in Six Sigma, and an MBA in healthcare management. And last but not least, the person I think who's time-wise at least in the worst time zone of us all. So thank you, Tiffany, for joining us from Saipan. Tiffany Cristomo is a Chief Operations Officer with the Commonwealth Healthcare Corporation in Saipan, or the Northern Mariana Islands, as it's formerly the title you've given us. Tiffany's career is deeply rooted in profound commitment to enhancing the well-being of a small community heavily dependent on a singular hospital and health system. So Tiffany is the lone voice of the public sector, and thank you for being with us. Tiffany is devoted to advancing healthcare delivery with a focus on affordability, equity, and non-wavering dedication to providing an exceptional patient experience through high-quality care. Please, Cobus, if you can go ahead and share with us some of your views. Thank you.
Thank you so much, Eric. So much for the opportunity as well today. Yeah, I think from my experience, as you mentioned as well earlier in the introduction, you know, I'm originally from Namibia in Africa, and I came to the Middle East about, I would say 6 years back, and then I became part of the healthcare network here for Mediclinic. I think something that we notice here in the Middle East, especially in the UAE, I can speak, is there's quite a lot of regulatory standards that get implemented, and because we have hospitals in the two different cities, which are two different, can I call? It's not like countries, but different domains, like in Dubai and Abu Dhabi. We do notice that there is quite a significant difference when it comes to the regulations from the regulatory bodies, but also if you think from a quality perspective, you know, there's also quite a lot of differences. So for us as Mediclinic, I think for us, we always see these quality metrics as a way of improving our service, because quality is one of the big things that we stand for. And we always try and see how we can incorporate that. I do think sometimes it's a little bit challenging, especially in the Abu Dhabi market, where there's a lot of metrics which I implement, and it's not always that the EMR, where you will usually get most of your information from, is built in such a way to be agile to accommodate all of these requirements so that you can report on a frequent basis as to what they require. However, we always try and accommodate this because this does make a significant difference to the organization as well as to the quality of care that we deliver. But I do think this is something that we always strive towards, is to see how can we accommodate this, and also to see from our perspective as a private healthcare provider, if we implement these types of quality standards and regulatory standards, what will be the impact on us when we deliver patient care? We are a JCI accredited institution as well. With that as well, we always get something new. There will always be something that gets identified. We as an organization do feel strongly about complying towards all these regulations, but we also use it when we see findings or when findings get notified or identified. For us, it's not like really something bad, but we rather see it as an opportunity for improvement. And that's why in the poll, one of the questions, I think it was the first question, I completely agree. I rather think we should try and, think of a positive way of getting people to comply with standards and regulations rather than imposing fines or, making the impact strong and bad on the organization. We should rather look at how we can support organizations that do not have the quality standards in place yet, or that do not have the ability to deliver all of that, to get to a point where they can deliver on high quality. So I'm more towards supporting in a positive way. Yes, I do agree. Sometimes it does happen that organizations don't comply yet. Then I believe stricter measures must be in place to manage that better. But I also think you need to positively work towards this. And I think this is something where Mediclinic also lead very well an example. In our organization, from a quality perspective, we always try and see how we can motivate our staff to identify events, or if there's any quality issues that they will pick up. How can we positively contribute towards them and get them to really understand that it's a good thing? We shouldn't feel if we report incidents that it's a bad thing or that it's reflecting bad towards somebody, but rather to see what's going to be the long-term effect and how it can positively contribute towards the healthcare network within Mediclinic. Thanks.
Okay, can I, before I hand over to Marco, this is quite a good opportunity maybe also to reflect on what you just mentioned in terms of the positive encouragement. Can you give some examples from your career, or indeed from Mediclinic? I know covers multiple jurisdictions, so maybe it doesn't necessarily have to be the UAE, but what kind of rewards do regulators provide, like apart from the known rewards, like giving you an accreditation label or certification?
Well, for example, in Abu Dhabi, currently in Abu Dhabi with the payers, it will happen in future that your incentive will automatically be linked towards your quality standards. So they have specific metrics that they measure hospitals on. And if hospitals have the ability to meet all the criteria, that will automatically support the healthcare organization then to have a better incentive from the insurance company. So from an insurance point of view, for us, from a private healthcare provider, that is beneficial because, for example, in an area like Abu Dhabi where tariffs are significantly low, it's not that easy to be able to negotiate with the payers to get the better tariffs because there is a lot of public healthcare providers. The private healthcare providers are all also competing, which is also big role players in the industry. So to have the ability to comply with these quality standards and KPIs that get set by the regulator, this will automatically support, I believe, positively support organizations to work towards achieving these types of regulations that is in place.
And I think that's a good point that you make. I think some of you may not be familiar with those kind of systems in your country, but there are systems in place where there's a monetary reward, if you can call it like that, where there's a reimbursement linked to reimbursement payments, which works quite well in healthcare systems that operate on an insurance-based model. But also from my perspective, as previously having worked in the regulatory setting, sometimes the regulator may be cautious about those approaches because they don't want operators. They feel maybe operators can game the system, or there's they feel like there's only a small. The regulator is quite small in many ways, and can feel a bit overwhelmed by the amount of hospitals that they have to regulate or the clinics that they have to regulate, and also feel that they may be prone to tell them what they want to hear rather than actually doing the right thing. But any thoughts on that?
Sorry. Yeah, so I don't think, I think from my point of view, the type of KPIs that they put in place, the amount of audits that they are doing, I think it's not really that organizations will have the ability to just play the system or just give the answers. Something we do see a lot as well as is regulatory audits. You know, just recently in the hospital where I work, for example, they did an audit on patient demographics capturing because it's one of the KPIs. And as soon as the organization do not comply with it, fines will be imposed on the organization. So they do give a warning, and the next time it will be a fine, and the next time it will be a bigger fine, which I feel is super important because since we have the central hub where all the data in the UAE is gathered, if patients are correctly captured in the system from a demographical point of view, that will work at the end, which is the long-term goal. So we all want to work towards that because that will again make healthcare records available across the UAE, which again is the easier thing. So I think from a regulatory point of view, uh, it will not be likely that healthcare provider, well, they can, but it shouldn't be likely that they play the system, you know, because of the frequent audits that gets happen, the KPIs that gets in place, all the information that we currently integrate with the regulators, you know, so they have so many ways that they have, can I say, gatekeeping in place to manage and monitor these type of KPIs that we have to monitor back.
Yeah. Okay, that's very interesting, and I think we can talk a lot more about this. But I think one of the things we want to leave for our next session is the interaction that you would have with the regulator, because I think that's also context specific. I think some regulatory actors, like some inspection systems, are more available when it comes to talking directly to the operators, and some jurisdictions it's much harder. And hopefully we'll have another session with the more regulatory perspective. But I know, Cobus, you have a hard stop, so I'm very conscious of the fact that you've just been with us for a while and talked to us about this so openly. So thank you for your time. I'll hand over the mic to Marco, and Marco will tell a little bit about his perspective from our from Brazil and maybe some other jurisdictions that he's worked in. So Marco, thank you for joining us.
Sure. Thank you, Eric. And so happy to be here. I send some hi to everybody who is in this webinar today. I don't know if it's good morning, good afternoon, good night for some of you. And I'm gonna talk a little bit about my experience in the Brazilian healthcare system. As Eric mentioned, I'm an industrial engineer, and I have a few specialization in healthcare. And also I'm a faculty of the Geneva Sustainability Center here in Latin America. And also I'm a partner of the Brazilian Hospital Federation, who is the organization that I also represent. I'm gonna start to talk a little bit about, first of all, I need to introduce the Brazilian healthcare system. You know, I think it's really important to have this big picture. And next, please. So Brazil has a unique dual healthcare system. You know, on one side we have the SUS, who is the Brazilian Unified Health System, or in Portuguese is the Sistema Único de Saúde. It's a universal public system which serves around 75% of the population, which is a lot, and is one of the largest public health system in the world. In the other side, we have the large private sector regulated by the ANS, the National Supplementary Health, which oversees more than 700 private health insurance operator and around 50 million beneficiaries. So at the same time, we have the healthcare facilities, the public and the private together, and these are regulated by the Anvisa, which is the Brazilian Health Regulatory Agency, which sets sanitary standards, control medication, medical devices, and inspect healthcare facilities. think of Anvisa as something between the FDA in the United States and the Joint Commission working together. So it's like a mix of they have a few play functions that Anvisa do here in Brazil. And very recently, and it's a point that I want to try to bring in this discussion, talking about regulation, we try to in Brazil we enact the NR1 as a new regulation from the Ministry of Labor that now formally require organization, including hospital, to conduct mental health risk assessment for workers. Like as we know, mental health is a risk and is something really critical on the world. So now we are also really focused in this NR1 law to support and benefits all the workers, co-workers in healthcare to bring this quality of health. Okay, so we can go to the next one. And this is a really simple one vision of what I'm saying about Brazil. Like Brazil spend 9.7% of the GDP in healthcare. That is not that much. And as I say, we have 76%, around 76% of the population use the public sector, and we have 51 million people who work the private insurance. Next, please. And this is the key of my presentation and what I'm bringing to this discussion, like how we can improve hospital performance and how we can through regulatory compliance. Like in my experience, the hospital that struggle the most with regulation are those that approach is reactively. Like they prepare for inspection, they check boxes, they create documents that live only in folders, and after the inspector leaves, everything goes back to normal. The hospital that truly improve are those that treat regulatory requirement as a minimum baseline and build quality management system that go beyond compliance. Let me share these three lessons. The first one is the translate regulation into operational routines. Like clinicians, nurses, technicals, everybody needs to understand what are the regulations in my hospital. And in some experience, I see that all the regulations are only in a few administrative departments. So regulation is writing in legal language. It tells you what is required, but rarely how to achieve it in a hospital with hundreds of staff. The work of hospital leader is to translate these laws or these requirements into daily routines. That's the challenge. And the second experience or the second milestone that I want to bring in this discussion is to use tools or philosophies like Lean and Six Sigma to close these gaps. Like many compliance gaps are actually process problem, and people who work with continuous improvement or with operational excellence work really close with the compliance department, with the auditors of the organization. So mapping the process, doing some root cause analysis are really important when we talk about the gaps that are created in our organization. In the third challenge, or the third principle is make quality data visible and meaningful to clinical teams. That's the top ones. One of the biggest mistakes I see is when performance indicator exists only for the quality department or for the regulatory reports. That's I see that in so many hospitals and so many organizations like use the dashboard, the Power BI or the command center only for a few specific areas, but the physician, the nurse, maybe they don't have this information in the day-by-day routine. So the start to own the indicator, they start asking why performance dropped last week. They need to feel the needs of the information. They need to understand that data or that information or that indicators are fundamental to perform better, to reduce risks, and to improve quality. So in summary, compliance is the floor, is the baseline. The hospital that perform best are the ones that use regulatory requirement as a launching pad for a genuine culture of quality, where improving outcome is the goal and regulatory compliance naturally follows. So that's the way, in my opinion. For finish my last words, next slide, please. We bring some key takeaways, like the first one, whether your work is a single payer system, a mixed system, or a fully private market, hospital leaders everywhere are navigating multiple regulators, multiple standards, and increasing demands. The question is not whether to comply, it's how to make compliance work for you. The second one, when we frame compliance as a patient safety, everything changes. Teams are more motivated, leaders are more committed, and the regulators, when they see that, tend to become our partners rather than adversaries. And the third one is about the mental health. That it was something that I was telling you in the beginning. It's a signal of a global trend. Like regulators are beginning to recognize that you cannot deliver high quality patient care without healthy support healthcare workers. I hope this become a global conversation, and I believe this IHF course and community is exactly the right place to have it. And I think we're gonna have a few moments in the end to talk more about this topic, and feel free to contact me to any question or something. Okay.
Thank you, Marco.
Thanks.
For this overview of some of the daily examples of struggles that people struggle with. I like the mental health part of it. That's not always highlighted enough. And also thank you for the system overview as well. It was very useful. And I think there's a lot of commonalities between all of the three speakers here today when it comes to actual implementing rules and regulations. And I think it's the good, the bad, and some of the complicated is coming out right there. So thank you, and I would like to hand over now to Tiffany, who's still with us, and thank you again for joining us. And maybe you can speak a bit about your experience in your country and how it is possible. There's one question actually that I'd like to throw to you already. It's about since I'm not sure if you would consider your hospital a small hospital, but there's been a particular question about what ways do regulations enhance performance in, Marco kind of described and Kobe described larger hospitals, but how does it help smaller hospitals, or does it help smaller hospitals? But anyway, without further ado, I'll hand over to Tiffany to answer those questions and other questions. Thank you.
Okay, so just a little bit about my organization. The CHCC, the Commonwealth Healthcare Corporation, is a public government health system. It follows the rules of the United States since we are a Commonwealth or territory of the US. Our system includes the only hospital, the public health department, behavioral health, primary care clinics, specialty care clinics, as well as a dialysis and oncology center. We are located in a small island territory, so mainly operating in a rural setting of about 50,000 people. And so thank you for having me on the panel today, and I hope that you find this information valuable to your organization. Next slide, please. So when we talk about regulatory compliance at our organization, we're really talking about the foundational frameworks that allow us to operate as a federally participating health system. And so these are the frameworks identified here. CMS conditions of participation is really the minimum health and safety standards that we must meet to participate in Medicaid and Medicare. They touch everything from governance, nursing services, medical staff credentialing, quality assurance, infection control, and emergency preparedness, especially with us being in a small island. We experience a lot of typhoons or emergency disasters that tend to come our way. But in many ways, they shape how we structure and operate our hospital and clinics. The second one is Medicare and Medicaid billing regulations. This is really about revenue integrity, accurate documentation, proper coding, medical necessity, compliance, timely finding, and compliance issues. So in our organization and environment, our Medicaid is capped, meaning they only have a set amount of money that they can pay providers within our territory. So it becomes really difficult, especially if there are billing errors or recoupments that will come our way. HIPAA and privacy and security rules, these protect against patient information across the entire system. And with the increasing cyber threats in electronic systems, data protection is really both a compliance requirement and a trust issue within our community. Fourth is EMTALA. It ensures that everyone who presents to our emergency room and the emergency department receives a medical screening exam, stabilizing treatment, regardless of their inability to pay. So for an island system like ours, this is really important because we are the only access point for emergency care. And oftentimes we have to send patients, we fly them to another island or to the US or elsewhere to receive the care they need. HRSA, federal grant requirements, I mentioned earlier, we have the Public Health Department as well. So many of our programs under that Public Health Department are federally funded. So these US grants come with very strict reporting guidelines, quality, and financial oversight as well. Finally is the OSHA and workplace safety standards. These regulations protect our workforce from infection control, protocols to hazardous materials handling, and workplace violence. So together, although they are separate, they do overlap and reinforce one another. So we've got to approach them strategically, really, and ultimately have a stronger performance across the entire health system. Next slide, please. And next slide. So this is the fun part here is when we talk about regulation, it's really easy to think of it as paperwork, right, or oversight. But the reality is whether you're under CMS or the Ministry of Health or another national authority in your country, every system operates within some form of regulatory structure, as we know. So first, with the good, at its core, regulation exists to protect patients, right? And I think that's where we can agree there. They are safeguards. I think Marco mentioned that they are the baseline, right? They help produce and they help reduce preventable harm and create consistency actually on how it's delivered. However, regulation in a way, I mean, it also definitely protects our organization because like I mentioned, we are the only hospital. We are in our small island organization. So we have to do this, right? Reputation matters and trust matters within our community. And it also creates transparency. Reporting requirements and audits force us to measure performance. Every month we have meetings with our departments to go over what their quality goals are, and we measure that on a monthly basis and an annual basis as well. They push us to look at our outcomes, our finances, and our processes really more closely than we might otherwise. Now, in regards to the challenges, compliance really takes time. And time is something most health systems don't have enough of, right? When staff are already stretched thin, these regulatory tasks can really feel like they're pulling away from patient care. And we've heard it multiple times. Documentation requirements, especially in electronic health systems, can really feel overwhelming to our clinicians. But survey cycles too, we do weekly surveys, and that can be exhausting to some departments when they're really short on staff. So preparing policies, gathering data, retaining staff, it really can create that constant sense of being inspected. And sometimes new requirements come without funding. So that already creates extra financial strain, especially on smaller resource limited systems. However, there is that part where it's not really good, where it's not simply good or bad, it's complicated. And an example is when funding models don't always match the patient demand. So when enrollment in certain insurances like Medicaid, right? It's a public insurance for indigent patients. Enrollment increases, but the funding stays capped, and that's one of the issues that we have here. Budgets are fixed regardless of service growth. Compliance expectations don't just decrease just because resources are tight. And guidance can always change, especially during emergencies, right? If we are experiencing a typhoon or policy shifts, we do tend to see when there's that flexibility in regulation. And that just essentially means that leaders have to constantly adjust while keeping operations stable. Every health system, I think, operates within their own cultural, geographic, and workforce realities. So the challenge is really honoring those realities while still meeting the national or federal standards. Next slide, please. And so this is where the shift happens and where the difference takes place. Compliance will always exist, right? The question is whether we treat it as something we react to or something intentionally used to strengthen our performance. So we want to move from that obligation to strategy approach, and that's when things change. First, integrating compliance metrics into quality council dashboards. And like I mentioned earlier, we have those monthly quality meetings to go over the departmental goals to see how we can help improve our processes in whichever the metrics refer to. So if compliance lives in a separate binder or office, it really becomes reactive. But when we keep compliance indicators alongside the quality and financial metrics, we can really identify risk early and not after an audit is done. Second is really conducting mock surveys. Those really help. Instead of preparing only when a survey is announced, we normalize readiness, right? Mock surveys reduce anxiety with staff. They build their confidence and really identify gaps before they become findings. It also strengthens our revenue cycle oversight. So billing compliance is performance, really. We prevent recruitments, denials, and documentation errors that already protect the limited funding we have. So every dollar preserved matters to us here. Fourth is standardizing policies because we have these different service lines. Policies can be fragmented, but compliance becomes inconsistent. So having that standardization really reduces confusion and it improves the accountability within these divisions of our health system. And then finally, just aligning compliance, finance, and operations is super important. I think when compliance decisions are made without financial oversight or operational change happens without compliance review, that's when risk can definitely happen and increase in your health system. Next slide, please. So really at the end of the day, for our organization, regulation is part of the environment we operate in. None of us can opt out of it, whether we're under federal oversight, a Ministry of Health, or another governing body. However, when it's led well, when we build it into how we measure performance, how we manage our finances, and how we run our operations, it really can create that stability, and it gives us clarity to how we can better protect our patients, our staff, and our funding to sustain our only hospital here. Thank you all so much for your time.
Yeah. Thank you, Tiffany. And you remember the question that was asked at the beginning? So Daniel from, I just read it out to you, from Daniel from Aruba, also an island nation, asked about the difference between large hospitals and smaller hospitals. And do you think, is there any examples of how in smaller hospitals regulations can improve performance? And
so the regulations that we follow, they actually require ongoing competency assessments and credentialing and privileging reviews. And we have to keep those documentations in place within our HR department, as well as the department that provides the training. So some of these examples that are required as far as training, and we have to prove upon surveys, annual training such as infection control or HIPAA training, emergency response. And yeah, so it's definitely embedded and it's a requirement.
Yeah, and I think it's probably relates to from a regulatory point of view, not having a one size fits all approach to it. And Marco, maybe that's something you can join in. We're just moving into the answers and panel discussion. If you, I think you highlighted a bit about the situation in Brazil, which is kind of a very large hospital, public healthcare hospital system. And maybe you can highlight also what does your regulator, does they make a distinction between private, smaller healthcare versus larger public healthcare systems, or?
I don't think so, actually. I think the regulation here in Brazil is not about the size of the organization, because, well, the big hospital, of course, they have more resources, they have more IT tools and other things that maybe a small hospital doesn't have it. But in the end, the rules and the laws are the same for all of the institution. You know, we can see in this big country called Brazil that you see some different system in their own system. Like you see big state that they have more resources, so they have this IT technology, they are working with AI and something like that, and you see some poor state that for that poor state, or they have less resources for that kind of hospital, is always a challenge to try to integrate compliance, as Tiffany said, try to integrate compliance from financial department with the operational department. That's a tough one. Some hospital doesn't even have a quality department structure. So in that way, I think that we have some differences, but the Anvisa in the NAS, they work the same thing for every kind of hospital, you know. But I think in the end, the safety, the quality and safety of the patient is the baseline for everything, you know.
Yeah, and I think this is one thing that we cover in the course as well about, and this question from Yusha Naveen in the chat, like about the, how do we actually make sure that that there's actually quality improvement? You talked a bit about, Marco, and as well as Tiffany actually talked about dashboards. What kind of examples can you give us about, quality improvement or regulatory led, whether it's internal regulations or external, that actually achieves improvements in service quality?
I start. I will. Oh, you go ahead, Tiffany. Do you want?
Yeah, I was just going to give, so one example as far as what we measure in terms of quality improvement and patient outcomes is for our pharmacy department. One of their goals is to measure medication errors, right? Ensuring that on a monthly basis that we are below that threshold of the medication, the national medication error rate. So, of course, by meeting that goal, by constantly monitoring it, patient outcomes are affected in a positive way. So,
that's good. Yeah. Mark, you were going to say something else as well?
Yeah, something that maybe I can bring to this discussion is when, as a continuous improvement and operational excellence manager, I work directly with the quality and safety department. And when this big hospital have this joint commission certification or the Kimentum or other, they start to work really close, like audits and quality department, with the process of operational excellence department. Because as I say in the beginning, like everything, start with the process. If you don't understand the patient journey, how you can improve quality of the patient. Like in some hospital now that I'm working in my firm, I see so many hospitals that only go to the Joint Commission because it's really important, but they don't have even the basic of a few patient flows, you know. So I think this for to start this discussion for improve outcomes and have better outcome, we need to understand the patient pains, or even not only the patient, the family, because the family is really crucial in this process as well, you know. So in my experience, I think start with the process and start with the people. Like we pay a lot for IT, like let's pay the best healthcare system or whatever, but we forget about the people. Like we pay system, it do pay good training for people, and should be the opposite. We start with people to improve outcome, then we understand the process, the flows, the patient journeys, the different patient journeys, and in the end, the technology can help us to bring this big picture of the or hospital scenario or organization, you know.
And maybe for both of you as well, like this question about the technology, as you mentioned, Marco, can play an important role. AI, artificial intelligence, how does that relate to your healthcare improvement strategies, specifically around improve patient safety and maintaining high quality? Do you have any examples in your part of the world?
Yeah, I have a few in some hospital, like artificial intelligence now is the thing, you know, in healthcare. Like everybody's talking about that. So I can see now here in Brazil a lot of robots, you know, a lot of apps that work to help patient to understand all the outcome that maybe should have in the process of your hospitalization, of your internation. So some hospital have this own apps when you can download it from the side of the hospital, and you can see all the track or your doctors, all your tests or whatever, you know, and they give you recommendation as well, like, oh, tomorrow you need to be here at 7 in the morning, and they give you a few orientation, because the communication is always a challenge, you know. So in my opinion, IA is helping in the communication in the beginning, and also bring all this information that sometimes is really hard when you have so many doctor or specialties, like you have a cardiology, you have an oncologist, and how you can bring all this together in one piece, you know, in one app or in one solution. So in my opinion, artificial intelligence is helping in this. There are so many functions, of course, that I can see in hospital. Looking at patient experience are helping to bring more information in an easy way. Like it's like you open your WhatsApp or something like that, and you can see everything that you're gonna do tomorrow. You know, that does help a lot.
Yeah. And Tiffany, from your side, I think you mentioned using dashboards as a single source of truth, or a common template that people would all use. Is that your experience as well with AI, or AI enabled, or?
So actually, we're still very new with AI. Almost similar to what Marco had mentioned is we are exploring AI in terms of translation, and looking at apps that actually help translate conversations between the patient and our teams, versus having that third person translate for us. So we're still very new to AI, and we don't really have much.
Yeah. And do you find that from a regulator point of view, are they also new to AI? The regulators that you deal with?
Yes, I believe so. I mean, there's nothing at this moment that's requiring any use of AI or so it's really what we can afford, right? Because we are a public hospital with limited funding, so exploring what we can.
Okay, there's a couple more questions, but I think in the interest of time, we take one more question from I'm sure where Olina is from, but it's a quite good question about the what metrics do you use to track improvements, and is that part of you as in particular, Tiffany, as part of your quality role in operations? What are the examples? I know we said earlier, like it's an enablement, right? So the regulatory requirements that you have enable you to kind of showcase to the rest of the world and to your own staff and patients what you're doing. But what have you done in terms of QI measured? What kind of examples can you give us? You know, the good, the bad, and the complicated again. Maybe
Sure.
Tiffany start.
So it depends on the departments, and so we probably have like maybe 20 or so departments or more that have those metrics identified, and we let them identify those metrics, right? Because it needs to be feasible. So in terms of, I mentioned how revenue cycle ties into quality and it ties into operations. So for example, for the revenue cycle department, their measure is to improve scheduling for patients that need follow-up and after inpatient discharge. So because we are one hospital and health system, we ensure that when we have patients discharged, we connect them to our outpatient clinics within X amount of days. I think it's within 2 days. And we have that appointment ready for their follow-up. In our children's clinic, for example, their goal is 100% of patients seen by pediatric providers in children clinics has to be up to date with their vaccination. In HR, we talked about, their goals are new providers. They need to be compliant with onboarding requirements, right? Policies and things like that.
Yeah.
And so there's a ton, and we let them to it.
Is it a standardized set, or do you said you developed it from the ground up from your own hospital, or is it standardized?
It's standard and required through CMS.
Yeah. So CMS would be your reference.
Correct.
Right? Yeah. Maybe that's a good resource to go into. Marco, do you want to add anything on the quality improvement measures, or?
Yeah. It's so interesting that Tiffany mentioned that the revenue cycle is a challenge in every country. You know, I'm originally from Chile, and I was working in Chile. Revenue cycle also is like a big challenge for any healthcare organization. And now Tiffany mentioned here in Brazil, it's a big issue. You have the payer, you have the hospital, you have the physicians. It's so hard to triangle all this. You have the providers. Anyways, it's so hard. And talking about the question of Elena about metrics to use to track improvement in patient outcome, I think I'm working in quality improvement more than 10 or 15 years. So in the beginning, it was no AI, no Trello, so everything was in Excel. It was really basic, really, but now you have so many technology to use to track, today I have a few clients. So how can I track all these quality improvement projects? So today I use Trello as a tool that helped me to understand and to follow all the implementation that this hospital, this client are using. And also another one is called Monday.com, who is also give you a really project management view of your project. So, and you can put indicators, you can put deadlines, and you can put who is the owner of this implementation or about this improvement. So today I think it's kind of easy to follow. Like we have so many tools, and with ChatGPT or cloud or whatever, like there are so many technology that help you to follow some of this of this improvement, So yeah, the thing about a project or about a solution, as Tiffany mentioned, you can go from reduce overcrowding. I have a big example here in Brazil that we did a public-private initiative with the Ministry of Health, where we are reducing the overcrowding in more than 200 public hospitals in Brazil. Only with process flow and training people and giving some tools, so this is a big project here in Brazil. And they have another one as well. This is the PPP, the private public partnership is something that in Brazil is really strong, because this big hospital, need to help the public sector. It's like a duty. So yeah, this is my experience about the outcome from TA measures.
That's good. Hopefully, this is a start for all involved in this. It does actually to answer the question as well to Alina. There is a module. Sorry to plug it a bit, but there's a whole module on impact measures from more what Tiffany already mentioned, and both Tiffany and Marco mentioned. There's a lot of resources out there that are accessible to everyone in the world, and I give some examples in the course as well. I think this is very, very helpful, and I found it very enlightening to hear from you. Three very different areas, but with similar issues and similar challenges. I will send some more. We will send some more information to all the participants, so don't worry. I think we have from the IHF Secretariat, I think they have 1 or 2 slides as well. They want to remind you of where you can find more information. I think we can show that slide. And yeah, I think we'll have more of these sessions. I particularly would like to see the regulator, hear the views from the regulator as well. I think there were some people here from who attended from the regulatory side. So if you are interested in participating as a partner or as a participant, panel participant, let me know. You've seen all the details here. We again would like to thank and say goodbye to Marco and Tiffany and Cobus, of course, for joining us today. And hopefully we'll see you again soon. And please watch this space. I think unless there's anything else from Tom, who's just in the message with the link, I will close this session. So thank you again, and look forward to seeing you again sometime. Thank you.